Hi, my name is Thomas Tate. I'm a first year at Harvard College, and this presentation will be about school start times in the United States and why they're too early, the health consequences of those early school start times, and potential public policy solutions to alleviate the issue. So the first section of this PowerPoint is going to go over some of the background of the issue, the history, and then the individual and societal level health consequences. So the problem is centered around the fact that school start times are too early across the country and that students are chronically sleep deprived. So as you can see, in 2015, among schools of all levels, the average start time was 8:03 a.m., which is about half an hour early of the recommended start time. The scope of the issue is quite large in the United States. Over 80% of high schools in the US start before 8:30, and more than half of them start before 8 a.m., which if the recommended time is roughly 8:30, as we'll discuss in a moment, multiple schools being greater than half an hour ahead of the recommended start time is absolutely ridiculous. Start time varies greatly across the states, with most schools in North Dakota and Alaska starting after 8:30, but no schools starting after 8:30 in Hawaii, Mississippi, or Wyoming. And then internationally, most schools begin around 8 a.m., just like the United States, but some countries like Finland can start as late as 9:45, showing that there is some precedent in the international community for delaying these school start times. Throughout history, this has been a very slow-moving issue, but we're recently seeing some progress, specifically in California, where they recently implemented a statewide law that recommended that all school start times begin either at or after 8:30 a.m. And this has been generally successful with some problems that we'll discuss in the policy recommendation portion, and comes as part of a much wider push to move school start times later in the day. This push began in 1996 when the University of Minnesota recommended that school start times be no earlier than 8:30, and Minneapolis Public Schools made this switch to follow the recommendation in 1996. By 2005, more than 205 high schools had switched to later start times, and the University of Minnesota's initial recommendation of 8:30 in 1996 was reinforced by the American Association of Pediatrics in 2014, once again recommending that all school start times start after 8:30. And there's a multitude of individual health consequences that come from these early start times. One of them is that when school starts before 8:30, students are observed to have headaches and migraines at a greater rate. Short-term sleep deprivation can cause increased stress, emotional distress, and issues with memory and learning. And then in the Gen Ed 1038 sleep class at Harvard College, in our week 9 lecture that occurred on November 1st, 2022, we discussed many of the physical consequences of acute sleep deprivation, including increased risk of cardiovascular issues, increasing risk for illness, and disrupting or hormonal regulation. And there's wide societal risk impacts from this issue as well. In schools that had delayed start times, there were 13% less car crashes among teenagers. Delaying these start times resulted in lower tardiness and disciplinary impacts. And as noted in the Gen Ed 1038 Week 3 lecture on September 20th, 2022, sleep is an essential component for our short-term and long-term memory. And when we miss out or deprive ourselves of enough sleep, those new connections are not formed and we miss out on valuable learning. By keeping these school start times earlier than 8:30 and limiting the amount of time students are able to commit these new ideas that they're learning at school to memory, we're limiting the potential impact of public schools, which especially considering that public schools are funded using taxpayer money, we really want to make sure that students are getting the most out of it they can and that taxpayers' money is being effectively spent, which currently is not happening when we're limiting the amount of learning that takes place in our schools. So some of the past interventions have generally been very successful. The biggest issue is that transportation costs and logistics are generally the biggest barrier for districts implementing these changes. Many districts want to, but don't have the resources to, especially in chronically underfunded districts that already can't afford to pay teachers fair salaries or provide school supplies for students. Pushing the school start time is simply not something that's a high priority in the face of simply keeping the lights on. In California, which is the most recent example of these school start times being pushed back, it came with many benefits for the students, but transportation and equity became a large issue that rose to the top following the changes. Grade averages have gone up, and there's been more reported satisfaction of schools from both parents and students. Students are already very stressed and overworked in high school, so intervention is required beyond just delayed start times, but delaying start times is a very good first step. Which leads us to the solution section. So initially, the first solution, the goal of the solution is to give students the best opportunity to get effective sleep. And this is going to come from two distinct parts, actual policy coming from the government and local districts, and marketing of sleep to students. So the policy is directed towards school districts. This portion is meant to serve as new restrictions and changes to how districts can actually function on a day-to-day basis. And then the marketing is directed towards families and students that is meant to change how families, parents, and students treat their sleep health in their personal lives, which the government can't mandate, but they can provide resources so that parents can make a more informed decision. And the biggest barrier to implementation of this policy is I defined as three different things: transportation equity, childcare equity, and the delay of after-school activities, simply making students stay up later and really making these solutions ineffective if they're just shifting the circadian rhythm later in the day. So we have to address these three barriers for any solution to be effective on a national scale. So first, the policy portion of the solution, which is to follow the California model and mandate that the earliest school start time is 8:30 a.m. This also involves the federal government providing additional funding to limit equity issues of transportation and to provide funding for before and after school childcare and enrichment programs for students with working parents. One of the biggest issues of early school start times is the fact that many parents work and rely on school as a form of childcare. And by investing in before and after school programs to be a form of childcare for these parents, it'll make the issue have less impact on our American economy. And we also need to mandate that each district create a homework policy to limit time spent on work at home. The reason I left this to be more of a district level decision is because many districts are very different. Some currently already have policies that mandate little to no homework. Some have no restrictions on it at all. So by leaving it up to a district level decision, it allows them to work with teachers and teachers unions to decide how to best educate their students while maintaining effective sleep health to ensure that learning done during the day is retained into the afternoon and into the following days. The next portion of the solution is the marketing, which involves a national television and social media campaign to outline the harms of sleep deprivation. Sleep deprivation, as we've discussed, can lead to more car accidents, headaches, increased cardiovascular risks, decreased emotional regulation, and more issues with hormones, which is a huge problem in developing humans. By having a national campaign on social media and on TV, it allows the American public to become more educated on something that currently in media is described as not a necessity and something that we should avoid. But in reality, sleep is crucially important to a successful day. I'd also encourage a federally sponsored sleep tracking app made available for interested families to track sleep health. This would be on an individual level within families and encouraged through schools. Federal government would obviously retain none of the data, but it would be made available for the families to be able to analyze their own habits and maybe agree as a family to turn the lights off an hour sooner to avoid shifting circadian rhythms. We'd also encourage athletes and coaches to address sleep via a campaign with professional athletes. One of the highest at-risk groups for sleep deprivation is athletes. And this is crucially bad because athletes are going to be among the most tired groups with almost everyday workouts, an increased workload from practices every day and games sometimes 2 or 3 times a week for certain sports. And it's important that sleep is addressed with these groups in particular so that they know to prioritize sleep in their daily lives to increase performance. This is just a rough timeline for the implementation of this policy. Obviously, the gears of government turn slow, so this can always be shifted. But initially, I have it being implemented, let's say a law passed next month would mean that in August 2023, the start of next school year in many states, the marketing campaign will begin at the federal level and new funding will be made available for students or for districts to begin implementing a decreased or increased delay in their school start times and to begin investing more into their district transportation. In January 2024, right after the holidays, an app would launch for families to begin tracking their own sleep. This is crucial that it launches before the actual start time is delayed in August 2024, so that parents can really see an increase in their own amount of sleep and an increase in the how their family would rate their emotions and their happiness levels and satisfaction with the district before and after the school start time. And then in August 2024, the school start time would be delayed officially across the country, and new district homework policies would be enforced to begin that time as well. This expected impact is great across many different aspects of American life. Later start times are associated with greater time in bed and greater length of sleep, meaning that pushing the school start time back doesn't just mean that students would stay up later. It means that they're spending more time in bed and are getting more sleep. Increased sleep duration alleviates the health risks previously discussed, like cardiovascular issues, and then also limits stress and anxiety and increases regulation of hormones. The later start times also lead to increased academic performance, something that all districts can get on board with. These are my references. Thank you. Have a great day.